Good afternoon.
Good afternoon.
Good evening, sorry.
Good evening. Good evening.
Good evening, guys.
Good evening, everyone.
All right. Hello, Fahra Malika, Moyani Rindi, Saka Kenzi. By the way, are you a new member, Saka Kenzi?
No, this is on the third session.
Oh, your third.
The third session.
Where was your first? When was?
At offline at Jakarta, right?
Oh, in IDN, Creative IDN.
I think 2 weeks ago, I think.
Oh, nice. Yeah. When
I'm sorry, I need to replace my name. It's use my son name, so I need to replace.
Oh, it's your son name.
Yeah, that's right. I'm sorry.
Okay, and then hi, Wulandari. Yeah, you're one of our loyal member, yeah.
Yeah, long time no see, Kak.
Yeah, maybe do you know what is our topic for today?
It's about understanding medicine and what they do.
Okay, maybe what medicine that you often to take it?
Maybe like for headache, like
Headache.
Paramex. Yeah.
Paramex.
Yeah, something like that.
Okay,
something like including paracetamol.
Oh, paracetamol.
Yeah.
Okay, so you take the chemical medicine, chemical based medicine. Okay. Have you taken the traditional one like ginger or
No,
kencur or jamu?
no, because I don't like the taste. So I don't like the taste of ginger, something like that in traditional medicine. So I only use some chemical one.
Most people today, they prefer to use the modern one, because it's much more practical. And most of people today don't like the smell of the traditional one. And sometimes it's complicated too, because you need to hit it, to smash it on a mortar and diulek sometimes.
Yeah. I see.
All right. Nice to see you again, Wulandari. Hi, Alfrida. Hi, Alfrida.
Yeah.
Are you a new member?
No. It is the fourth time, I think.
Oh, the fourth time.
Yeah.
For online, or have you joined offline too?
I never joined the offline class.
Oh.
Maybe sometime next.
Oh. Where do you live then?
I'm living near Bandung, but not Bandung. I'm living in Sumedang.
Oh. You are quite far from Jakarta, yeah. So on the online that you can reach.
Yeah, but I want to try the offline class if I have the change.
Oh yeah. Don't worry. This is the specialty of online class itself, yeah. Even though you are far away from Jakarta, you're still able to join us. Yeah, for example, including me. I'm in Denpasar, Bali. Yeah. And I'm in this room, in this screen as an MC. All right. Good evening, everyone. I'm Dika Narendra, will be your MC for today. Before we start our class, let me share some announcement from Britzone. Okay. Right, guys. Welcome to Britzone, the largest English community in Indonesia. Yeah. And then we are free community too, so you don't need to pay anything to us because we are free. And then we have three values, three philosophy. The first, we provide English education, and as I've said before, we are free and open platform. Everyone can join us, no matter your background, no matter your skill, and there is no judgment between us. So don't worry if you're still doubt about your skill. Just join us. You will not be bullied. Just learn together with us. And then we are volunteerism. We are gratefully empowered by wonderful committees and conductors, and for free. They are not paid. And then we have 3 classes in a week. The first is Britzone Speaking Academy on Tuesday, which is today. Focuses on public speaking. And then Betterment series on Wednesday starts at 7 p.m. GMT plus 7 waktu Indonesia Barat. Touches 4 skills in English. And then the last but not least is Britzone Fun Day. Starts at morning 11 a.m. on Saturday, and sometimes it serves offline class too. So if you live in Jakarta or the suburbs like Bodetabek, just you can join the offline class easily. And then we also have some social media accounts. Instagram is the most updated one, and right now we are being live streaming on our YouTube channel, Britzone English Community. And don't forget to follow our Twitter and then Clubhouse and also website. And also don't forget to listen to our podcast in Britzone Podcast on Spotify. Then because we are free and open platform, you can help us by buying our merchandises on Busy Merch. There is the QR code if you want to order, and then these are our merchandises: the t-shirts, the tote bags, the sticker pack, and the notebook. And then we are officially sponsored by Perpustakaan Kemendikbud. Is located in Jakarta in Kemendikbud, the Ministry of Education and Culture. Gratefully in this era it has been opened again for public, but we have not served our class in that place too, because just pray and hopefully we can go back to our official home, because our official home base is on Perpustakaan Kemendikbud in Sudirman, Jakarta. And then after class edition, we will take picture together, but I move it to at the middle of the class. And don't forget to leave your feedback that will be posted on participants group in WhatsApp group. All right, that's all from Britzone. And in this week, in this month, Britzone have special event. It's called Britzone Festival. Let me share the Britzone Festival slide. Wait. Okay, here are the Britzone Festival. There are some competitions, yeah. They are writing, yeah. Yeah, if you are interested to join, you can register yourself, yeah, by this link. Yeah, you can scan it. And then if you love to sing, yeah, don't worry. Yeah, to share your voice in this competition. And also we have speech competition. Yeah, and if you want to join this competition, you can, yeah, practice your speech here, because the Britzone class for today is Britzone Speaking Academy. Yeah, you can, yeah, practice. You can learn how to speak properly together with us in this class. Yeah, hopefully, yeah, you will get champion in this competition. All right. That's all for the announcement. Now, without further ado, let me call our wonderful conductor. He is a pharmacy teacher. Yeah, she is very interested in pharmacy. Yeah, she spends her life a lot in pharmacy industry. So here she is, Putri Amelina. Go ahead.
Hello, Britzoners. Thank you, Dika, for your introduction. Hi, Britzoners. Oh my God, thank you so much for coming. Hi, I really love your energy, all of you. Thank you so much for coming here today. I really appreciate your time, your energy, and your passion that you put into this class. Well, I really love Tuesday class because we can discuss various topics, and one of them is about medicine today. Don't worry, it's not going to be heavy or you're not going to be confused. I will try as best as I can to explain this in a very fun and also easy to digest. Okay, thank you so much, everyone. Wait, I'm going to share my screen. But before I'm sharing my screen, I would like to ask some of the listeners here. I would like to ask Kak Ria Pangaribuan. Hi, Kak Ria.
Hi,
Hi. Hi, how are you doing, Kak?
I'm good.
Wow. So how do you feel about today's topic? Do you think it intrigues you?
Well, excuse me a moment because my okay.
It's okay.
Actually, I always interesting with what Britzone bring it up in every part in every session, including this. So it must be have unique information, interesting information inside.
Mhm. I see. All right. Wow. Thank you so much for your kind words, Kak.
Yeah, thank you.
Okay. So you see my screen?
All right.
Okay. Thank you so much, Bev. All right. Hi, everyone. Thank you so much. Let's learn about not learning, but it's actually a sharing session with all of you today, the amazing Britzoners. It's about understanding medicines and what they do. So welcome to Britzone Speaking Academy. And I want to say welcome to if you are also a pharmacist or physicians or any other professions in here that come to this class. Welcome. All right, so today we are going to talk about understanding medicines, and I would like to say welcome to Busy Pharmacy. So let's just imagine Busy has a drugstore one day, maybe like 10 years from now. We have our own pharmacy. hopefully that will educate our people and so many people out there about medicines and how to use medicine. So welcome with me, Putri. You can call me Pupu. Normally, Britzone committees call me Pupu. So with your pharmacies, Putri. And yeah, I've been becoming a pharmacist for in total 5 years. So I've been teaching pharmacology in my school, in the school where I work for 5 years as a pharmacology teacher. And we basically talk about how drugs work in our body. And also, I happen to be vice president of Britzone in this year. Thanks to all of the Britzoners who for the trust, and I will make this Britzone to be a platform for everyone to share everything that you know to other people. So thank you for always returning to our classes. And our topic for today, we'll discuss these 4 topics, these 4 outlines. So I'm going to okay. I'm going to explain to you about facts or myths that we always face in this era about medicines. And then we will know deeper about pharmacy and medicines and how does our body process medicine. So hopefully it will be beneficial for all of us and you will not get bored during this session. And yeah, so if you want to ask question, you can just unmute yourself and ask me. Okay, so let's go to the first session. It's about facts or myths. I'm going to choose one prisoner to answer this. Who will that be? I think I'm going to ask, let's, Kak Dian. Hi, Dian. Hello, Dian.
Hi.
Hi, Dian. How are you doing?
I'm doing okay. How are you?
I'm great. Thanks for asking. So, Dian, we're playing facts or myths about medicine. Are you ready to answer this question?
Uh-huh.
Okay. So, Dian, do you think antibiotics are the answer for every illness?
No,
Is it
because
fact
we
or myth?
also myths because we also have antiviruses. We also, I don't know, different kinds of medicines for different kinds of diseases, because not all illness and diseases are caused by bacteria. It can be caused by fungi or maybe what else? Viruses like the one that we're facing right now, coronavirus. So I don't think so. I don't think this is a
Coronavirus.
fact. Yes.
Okay. Wow, that's absolutely correct, Dian. You're so knowledgeable. Thank you so much for asking.
You're welcome.
What Dian has said is totally right. Thank you. What Dian has said is totally right. It's myth. Yes, antibiotics are only helpful in illnesses caused by bacteria, such as strep throat. When you think like you have your throat is like you cannot swallow food, or this kind of illness that is infected by bacteria. And different illnesses and even different types of bacterial illnesses require very precise types of treatment. And normally doctors don't want to prescribe antibiotics when they are not needed, because overusing these antibiotics may lead to resistance and hard to treat infections. I will explain to you deeper about it later. Okay, let's go to the next questions. I think I'm going to choose for Fasil today, whom I just met, Kak Mutiara. Hi, Kak Muti.
Hi.
Hi. How are you doing?
I'm okay. How are you?
I'm good. Kautiara, I came to your class last week, and I was so amazed by how you deliver your presentation
Oh,
about
thank you.
Malaysia, right?
Yeah,
All
thank you so much.
thanks for being our conductor, Kautiara.
Okay, cool. Thanks.
So yeah, the question for you is: facts or myth? It's okay not to finish antibiotics. You can give your answer, Kak?
Mm, I think it's a myth because I don't know for some reasons antibiotic
Okay.
need. Sorry, can you guys hear me? Is it me lagging or pupus?
Oh,
No, you're okay. And
Oh,
also
okay.
Pupil.
Okay, cool. So okay,
I think it's me lagging.
yeah, just a little bit. Okay, it's fine. Let's get back to the topic. Uh, I think it is um, it's a myth, yeah, because I do believe that antibiotics needs to be consumed within certain period, and yeah, I think it's a must. I don't know, guys. I mean, my father is a doctor, and that's what he said. So I don't know the any medical background about that. Wait, Pupu is lagging, right? Wait, hold on.
Oh, yeah, right. Hi, Poo.
Okay, cool. I thought my connection is not good.
Poo, you can close your camera if you don't mind.
Mm, good.
Okay, itu kamu Tiara. Okay. Oh yeah. Do you still talk? Oh, is it me?
Yeah, can you repeat what you said?
Am I breaking
Sorry.
down? Jeff?
Yes, Pupil, it's a bit, your sounds a
Oh,
little
yeah.
breaking.
So
And also your
yeah, so I
video.
think it's a myth, yeah, kamu Tiara.
Sorry?
All right.
Wait, hold on.
Okay, thank you very much.
Okay, cool.
Okay, cool. Thank you. Okay, next we have the answer right here. Am I audible?
Yes, you are doing well right now.
I will turn off the video because of my connection is unstable in here. Yes. So yeah, it's not okay, guys, to not finish your antibiotics because by not finishing antibiotics, you might contribute to the dangers of antibiotic resistant bacteria. And this is very dangerous, and this is something that we are prohibited to do this because it will make the bacteria even stronger. Then you will need more dosage of antibacterial to kill the bacteria. So what Kak Tiara has said is correct. So thank you so much. Let's go to the next myth or fact question. I will ask Kak Nona. Hi Kak Nona.
Hai Kak,
Hello.
halo.
Hi. So what do you think, Kak Nona? Is it facts or myth? Medication can be taken safely with any liquid.
Liquid it's like injection, you mean?
You mean when you want to take your medication, you can either like drink alcohol
Oh,
or
sorry. No, I think it's fake. Yeah, it's facts because
uh-huh.
we cannot consume with coffee or tea,
Mhm.
if I'm not mistaken.
Yes. All right. Thank you, Kanona. Yes. Here's the answer. It's a myth. Medication can be taken safely with any liquid. That's a myth because instructions on medication administration should be read carefully. Some liquids may enhance or diminish the effect of medication. I will tell you about it more later. And let's go to the next question. I will ask Kak Wulan. Hello, Wulan.
Halo Kak Pupu.
Hi.
Hai Kak.
Hi. Yes, can you?
Halo Kak.
Am I audible, Kak Wulan? Yes.
I can hear you Kak.
Okay, so what do you think about this? Is it fact or myth? Splitting pills is always a safe way to save money.
I think this is a myth.
Uh-huh. Can you tell us about your...
I don't know exactly what the reason, but I think it's a myth Kak.
Thank you very much for saying your thoughts about it. What
Yeah.
about Kak Ria? Could you please help Kak Wulan to answer this facts or myth question?
With
What do
me?
you think, Kak Ria? Yes, Kak Ria
Um,
Pangaribuan.
well, I um I think I don't have any idea about this, but I ever heard that people buy the medicine from the receipt. Sometimes they split it by two. I don't know. It's split the pills or how they how the prescription how they about the prescription. So no idea at all.
Oh, okay. So do you think it's facts or myth?
I think it's a myth. Yeah,
It's a fact?
yeah, it's a myth.
Oh, it's a myth. Okay.
Yeah.
Thank you, Kak Ria
Yeah.
Pangaribuan. Thank you so much. Yes, the answer is it's a myth. Splitting pills is always a safe way to save money. It's a myth because by doing so, we can disrupt essential properties of the medications. Because there are technology in medication. For example, some medication contains a time release property. If you know Vitalong it contains a time release property that is destroyed when the pill is cut. So reducing the medication safety because you try to split the pills. And because some pills are made with a protective coating to prevent nausea, if you split into two, it will make your stomach upset. And it may result, if the coating is broken, always you can make your stomach upset, and then you can always ask your pharmacist, is it safe to split the pills? So please always ask your pharmacy. And the last one, that's the last question. Thank you so much for participating in facts and myths. Now we can go to the next one. The next section is our type of medication that we have in Indonesia. Okay. All right. So here are the types of medication that we have in Indonesia. We have like prescription only drugs, over-the-counter drugs, and herbals. So yeah, by seeing this types of medication, I'm sure that all of you already consume all of these types of medication if you are in Indonesia or even outside of Indonesia. And first of all, for the prescription only, you can only take these medicines by giving your prescriptions to the pharmacist. when you want to consume medication or medicines, you may go to the pharmacies and then ask them to make or to give the drugs. Okay. For instance, the packaging is marked with a red circle like this, and with a black border. So it's called in Indonesia obat keras. And then next we have, for instance, we have here captropil, and we also have, sorry, okay, we also have piroxicam as the example of obat keras, or we call it prescription only drugs. And we also have tramadol as the example. So when you want to consume this kind of drugs, you need to bring your prescriptions that was written by your doctor. And also, this logo or the symbol is called psychotropic drug. So it's a strong drugs that are efficacious effect and the composition of central nervous system that can cause mental and behavioral changes. And it can only purchase with a prescription as well. And yeah, the packaging is marked with a red circle and with the border. And normally in this kind of drugs, as for example, we have diazepam, phenobarbital, and chlorpromazine. Next, we will go to the over-the-counter drugs. So yes, this is called free medicine. It's called obat bebas in Indonesia. Like, for example, Panadol. It's medicine that can be purchased without a doctor prescriptions. So the packaging is marked with a green circle, this one, and a black border. Yeah, so it's free and you can buy it freely without doctor's prescription. For example, paracetamol or vitamin C or salicylic powder. Next, we have this one. We call it obat bebas terbatas in Indonesia. It's very limited, and we need to be careful in using these drugs. And it's a strong drugs that can still be purchased over the counter without a doctor's prescriptions. But their use must pay attention to. You can pay attention to drug information on the packaging. For example, this eye drop, the border is black and the box is black. It contains warning like this one. You can't always use this eye drop every time you need. You need to pay attention into the information that is attached in the labels. So that's about this over-the-counter drugs. And let's go to the next drugs. It's herbal drugs. So in Indonesia, we usually have three kinds of herbals. It's called jamu and phytopharmaka and obat herbal terstandar. So all of them are very different. And when you drink jamu, it's not clinically tested by the pharmaceutical industry. So it's based on empirical experiences. Okay, so that's about type of medication. Let's go to the next slides. Sorry. Yeah. In this class, we want all of you to be smart in using drugs, in using medicines that are like when you want to consume, loved ones want to consume medicines. So you can give them some explanations about the information. So let's be smart by asking these questions when you get the medicine. Okay. Okay, here are the 5 questions. Yes. Here are the 5 questions. Sophia, can you see my screen or is it freezing?
It's freezing
Yeah,
right now,
I
Pupil.
I can see a screen, but yeah, I think it's lagging. Yeah, now it's okay. It's okay.
Okay, all right. I'm so sorry for the inconvenience because I live in a rural area, so the connection is unstable. But that doesn't stop me from attending this class. Okay, so here are the 5 questions. What is the name of this medicine and its contents? The next question would be, what are the benefits of this medicine? And the next one, what is the dosage of this medicine? The fourth one is how to use this medicine. And what are the side effects and the interactions of these medicines? So by asking these questions, you can protect yourself from false medications or even a medication that you don't need to consume. Okay, so the next to discuss is how does your body process medicines? I'm going to share you the video. All right. I will stop sharing my screen. Okay, so after all of my do you guys have any experiences about using medicines in your life? Maybe like Ai, do you want to share about your experience, your personal experience in taking medications? And how do you usually get information?
Anyone can hear my voice?
Yes, it's
Okay.
clear.
Yeah. Actually, I am the person that really trying last to take medicine. Actually, maybe if if that's really needed, like maybe I couldn't hold again about my disease, or maybe it's really might be what is it affect my activities. So maybe I will take medicine, but still I will find like the doses that's really what is it maybe less doses, like maybe what kind of the I will choose, and also I will search before I take the medicine, and yeah, maybe, and also sometimes I just take a medicine that really what is it common that I use, like paracetamol or ibuprofen, something like that. But actually,
Yes.
if I feel like there's something bad, or maybe there's something wrong from my body, I just need to take a rest and just drink a water, or yeah, take kolak angin, something like that. Yeah, so I really like what is it? Really careful to take a medicines. Yeah, maybe if I need to take to go doctor or something like that, then I will have prescription from a doctor. I will use it. I will take the medicine, but if not, I really trying to close away of yeah, so far away from medicine. Actually, yeah, that's
Yes.
an experience.
Okay. Thank you. Well, thank you very much, Kai, for sharing your experience on how you take your medications and how you manage the medication that you put into your body. Okay. So so it's audible, right? And you can see my screen?
Yes. Yes.
Okay.
Yes, yes, yes.
I will continue.
A drug is a chemical or biological substance that affects the body and its functions. Drug absorption is when a drug enters the bloodstream. The level of absorption can affect the speed and the quantity of the drug at the site of action. This is termed bioavailability. If a tablet releases the drug quickly, blood levels may become too high, whereas slow release may result in low levels of absorption. Additional factors affecting absorption and bioavailability include the properties of the drug and the physiology of the person, such as pH levels in the stomach and its speed of emptying. Therefore, specific formulations are used to release the drug at the desired speed. Common formulations include tablets, capsules, suppositories, transdermal patches, and solutions. Drug metabolism is the process by which the body breaks down drugs, which mainly occurs by means of enzymes located in the liver. Many factors, including intake of specific foods and other drugs, can increase or decrease the speed at which drugs are broken down, and thus determine their levels within the blood. A drug may be broken down to stop it from working. However, there are other drugs that need to be broken down or modified before they become active. These are known as prodrugs. Some drugs are directly eliminated from the body by the kidneys in urine. For this to happen, the drug must be water-soluble. Drugs that are not water-soluble may be metabolized by the liver or enzymes in the blood into breakdown products that can be eliminated in urine. Diseases that affect the liver or the kidneys can cause blood levels of a drug to increase.
All right. So have you watched the video?
Yes.
Yes. Okay. Thank you very much. Okay, so that was about how drugs work in our body. So as we can see here, okay, I will stop sharing. And then after drugs give the effects in our body, we can prevent, the first thing we need to do is to prevent the drug interaction to happen. So how to prevent it? You can check the drugs interaction to prevent the interactions by sharing this, by opening this website. I will share it to the chat box. You can check the interaction by checking this interaction checker. So you can go to this website and type down the medicines that you want to take to prevent the drug interactions from happening. Okay, so I think that will be all for the presentation. And then we're going to go to the FTD session with our facilitators. And I will give the control back to the Sophia, not Sophia, but Dika, our MC for today. Thank you.
All right, guys. Yeah, thank you, Pupu, for the material. Hopefully it will give you more insight about the medicine and be wise for the using of the medicine itself. Now, before we jump to the FTD session, now I'm gonna open for the Q&A session for 4 questions from 4 different people. Anybody wants to ask? You can raise your hand digitally. Okay, I first. Go ahead, I.
So much, Kadika. And then thank you also for Kapupu for sharing your knowledge about drugs or medicines. Okay, Kapupu, actually, I'm really curious about just a case like antibiotic. We talked before that antibiotic actually must be, must be clearly taken by us when we got the medicine from the doctor, right, Kapupu? Yeah.
Yes,
so,
Kai. That's correct.
So how if we if we didn't taken it clearly, and then the next time we feel like we want to take the medicine again, and it works or still effectively to us to precautions, or maybe like precautions, the bacteria again, or not effective because we didn't have symptoms again about that disease. And then the second one about the split drug. How if that happen into kids? Because sometimes if we give to a kids, we just split it because the doses is lower if we split that drugs. That's my questions for Kapu. Thank you so much, and I really appreciate your experience and knowledge for tonight.
Okay, thank you very much for the question, Kai. Maybe I will try to answer after Kak Mutiara give the questions as well. Kadika?
Yeah, you answer I first too.
Okay, all right, thank you. So for Kai's question, it's about antibiotics. I think it's very important to know why do we have to finish antibiotic and why is it important? It's important to take the medication as prescribed by our doctor, even if you are feeling better. When you take one tablet of antibiotic, maybe like, oh, I feel better now. But if you stop the treatment, if the treatment stops too soon, and you can get sick again, and the remaining bacteria will become resistant to the antibiotic that we have taken. So, and then if this bacteria become resistant to the antibiotics, they can potentially do even more harm. It may take longer for us to recover from our illnesses, and your physician or your doctor may have to prescribe more medication with more dosage. So that's a thing that we need to know about antibiotics. And I remember one of my lecturers said to me when I conducted a research in a hospital about antibiotic resistance. There are so many people who get antibiotic resistance because they stop the treatment when they feel better and they don't finish the entire course of treatment. And yeah, and they're feeling their risk is a relapse, and worse, by not finishing, we might contribute to the dangerous rise of antibiotic resistance. And if it happened, this cycle happened all over again, our bacteria that infected us cannot be killed even by the strongest or the highest dosage as possible with any antibiotics. So that's the dangerous side of what will happen if we don't finish antibiotics. And about the splitting pills, that's why I put this into this material, because there are numerous myths that say, oh, why don't we just split into half and then give to our daughter or our son? That's not true. There will be a purpose for the dosage. And if we just split it without any prescriptions from our physicians, from our doctor, or you haven't asked to the pharmacist, is it safe if we split it? It will cause even more harm too for your kidney to digest, to absorb the medications, the substances. Because there are some purposes why pharmacies in the pharmaceutical industry to make and invent medicine using like maybe when we see Vitalong say, as I said earlier, if you see the capsule, you can see the granules inside of it. That's the purpose. So it's actually not safe to split it into half because there's a purpose. And the reason why we make it that way, because we want to make the drugs absorb into the body and uh, give the response when we drink the drugs. So I think that will be all for my answer, Kai. Hope it answered your questions.
Yeah, yeah, really answer my questions, but still, how if I maybe I pause to consume antibiotic maybe in one day, and then the other days or 2 days again, I continuously to consume that antibiotic is ineffective or still have effect?
Okay. Yes, maybe we can talk to our doctor or pharmacist about the best way to take our antibiotics. Some should be taken with food to reduce the side effects, but others need to be taken like on an empty stomach. But antibiotics, one thing for sure is antibiotics should be taken in the prescribed amount and for the directed length of the treatment. It's your doctor who knows about that. So the proper way to take antibiotics is we have to take them exactly as our doctor tells us, and do not share our antibiotic with other people, and don't save them for later. You can just finish it. Maybe your doctor prescribe you for 3 days, so maybe your doctor prescribe you 3 times a day, and then he gives you like 9 tablets, so you can finish it for 3 days, 3 for each day, and then do not take antibiotics prescribed from someone else except your doctors. Yes. So how does it answer your question, Kai? And the length of your treatment depends on the type of infection that you have.
All right. Thank you, I
Thank
for
you,
the
Kai.
question. Now I still have for three slots left. Yeah. So there are the Mutiara, Listra, and Yigin. For the rest, Ari, Wulan, and Dian. Yeah, sorry, yeah, because the time is limited. Okay, go ahead, Mutiara.
Yeah,
Hi,
Kak Muti.
Pupu. Hi.
Hello. Hi.
So after watching the video, I'm curious about certain things. So in the video, the guy mentioned that there were several foods that might lower or speed up, the process of our body to take the medicines, all that. So can you mention any of the food that we cannot eat, or that might be slower the process of the medicines to enter our body? So that's my question. Thank you.
Wow, just like Kak Ai's question, that is a wonderful question. Thank you, Kak Mutiara. Okay, so when we talk about food that can hasten the effects of our drugs, we also talk about food and drugs interaction. So when a food affects medication in the body, this is called food-drug interaction. And food can prevent medicine from working the way it should, and can also have medicinal side effects to become better or worse. And drugs can also change the way the body uses the food. I will give you the example. If you want to know what are the foods that will fasten the effects of the drugs, it's very different from each drugs, because every drug has different in my screen. It's a Medscape. So if you want to check the interaction from your drug, or maybe like drug and food interaction, you can use this website. Okay, for example, let's say Kak Mutiara consume captopril. Okay, you can type it, and then you can search for the interaction and add the second drugs. Kak Mutiara maybe consume paracetamol. Oh. Acetaminophen, it's the other name for paracetamol. Oh, no interactions found. And about food interaction, you can go to drugs.com. Wait, I will also share it to you. Okay. So in this website for Medscape, they only identify the drugs and drugs interaction. And for food and drugs interaction, you can check drugs.com. Wait, I will share my screen as well. All right. This.
Sorry, you are muted.
You're still muted.
You are muted.
Now? Yes, so there's an interaction we found in this paracetamol. So you cannot drink alcohol when you want to consume paracetamol. It will lower the metabolism, it will lower the absorption from paracetamol. And paracetamol disease interactions, there are 3 disease interactions with paracetamol, which include alcoholism and liver disease. So when you have problem with your liver, it will be a problem as well for the absorption of the drugs. So you can check this website if you want to find out when you drink certain drugs, okay, do I have to drink this, or can I eat this food before I take my medication? So you check in this website. So they have very complete interactions. There are drug and food interactions, and also drugs and drugs interaction. And hope it answers your questions, Kak Mutiara.
Thank you. Yes, it does. Thank you, Popo.
All right.
Yes, my pleasure.
Thank you, Mutiara, for the question. Now let's move to Listra.
Okay, thank you, Kak Dika. So Kak Pupu, I have a question, but I'm not sure whether it's your field or not. If I'm not mistaken, every medicine has its expired date. So I wonder where we should throw safely this expired medicine, Kak.
Okay. Sorry, I cannot really hear your voice. Could you please repeat?
Oh yeah, yeah, Kak. My question is where we should throw the expired medicine safely.
Okay. Oh, about expired date. Yeah.
Yep.
So, yeah, after the expiry date, medicines may not be safe or as effective as it should be. So we should not take medicines after their expiry date, because if we've had medicine for a while, we need to check the expiry date before using it. And we need to also make sure that we've stored the medicine properly, because it also affects the stability of the medicines. Besides expiration date. So what I've already read a research from Harvard Education. They found that from their research, they found 90% of more than 100 drugs, both prescription or over the counter, were perfectly good to use even after like a week of expiration date if the medication is stored really well. So the expiration date doesn't really indicate a point at which the medication is no longer effective or not, but it can last for a week. So after that, it become unsafe to use. But it's better to choose not to consume that before the expiration date, because not only it will be maybe dangerous for our body, but also the effect will give like lessen effect for us. So yeah, so I think that's what I can give for you.
Okay, Kak.
Hope this answer your question.
Yeah, thank you, Kak.
Thank you so much.
All right. Thank you, Listra, yeah, for the question. And the last question from Yin. Go on.
Oh yeah, Yin.
Hi, Kak Pupu.
Hi, Yin.
Okay, Kak, I wanna ask two questions. The first one is about the myth that drink milk will causes the effect of the drugs. Is that true or no? And then the second one, I have a questions about my childhood experience. Like, did you know puyer, Kak?
Oh yeah, we call it pulveris in pharmacy. Yeah.
Oh, okay.
Yeah.
So I ever watched the pharmacies like mix like many drugs of it, and is it safe to be consumed? Because when I was child, I always consume that. Thank you, Kak Pupu.
Okay. Oh, thank you so much. That's a brilliant question, Kayin. Yeah, let's talk about milk and drugs. The interaction between milk and drugs are mostly, we call it in pharmacy, pharmacokinetic interactions. Since the milk effects, has affect the absorption and excretion of drugs, and it's classified as moderate in severity because it can occur a failure in the treatment. And so most of the medication, for most of the medicines, we don't recommend our patient or people to have milk with medication because milk can interfere with how iron that is contained in the medication absorbed in the stomach. And the calcium found in the dairy products or the milk, it can prevent the body from absorbing the medication, the medicine, or I've ever found in my lab. So I had conducted a research with the rat, and also I I injected tetracycline and ciprofloxacin for the rat, for the mouse, the very small mouse. We injected tetracycline, and also we give the rat or the mouse milk as well. And we find out that the tetracycline and ciprofloxacin that we injected earlier has less of the active compound in the mouse bloodstream, because the calcium that found in the milk can prevent the body from absorbing the antibiotics that we injected. So we need to avoid dairy when you want to take your certain medications, including antibiotics, such as I said earlier, tetracycline, doxycycline, or ciprofloxacin. So we need to avoid milk first for 2 hours before we take our medicine. Okay, so what's the next question, Kain? It's about pulveris, yeah. Okay. So is it safe to consume pulveris? Yes, it's very safe, because pharmacies doesn't like, okay, we're going to mix all of this together. No, we have our consideration about how our body will react with the medicine that we make. So it's very safe because we put another substances to protect our stomach or our what is it? We call it to prevent us from feeling nausea. So we usually put Equal. Do you know Equal? To make the drugs doesn't become bitter. So it's very safe because the doctor prescribed it. And every time we found interactions in the drugs or in the medicines, we will communicate it with the doctor, and then we will change the medicine if it's required to do so. I think that is my answer. Hope it answer your questions. Kayin?
Thank you so much, Kak Pupu. Really clear explanation. I love your answer.
Okay. Thank you. Thank you so much. Yes. Thank you. So how is it, Kak Dika?
Right.
Do you still have questioners?
Thank you, Yijin, for sharing your question. Now, please open your camera, guys, and we will have a photo session. Okay, Sophia, do you mind to capture?
Yeah. Yes. Okay. So there is one slide. Okay. So Haris, hello, Afrida, Raihan, Ari, would you like to turn on your cam? Okay then. Okay. So don't chat because your face
Please
will
don't
be
chat.
blocked.
It will block your face.
Yeah.
Okay. Block your
Okay.
face.
Okay. And then yeah. 1, 2, 3. Okay, thanks guys. Okay, back to you, Dika.
All right, thank you, Sophia. Now, the FGD for the impromptu speech, you will be led by the facilitator, and the FGD will last for 20 minutes, and the host will divide you into some breakout rooms. See you guys.
See you guys. Enjoy your discussion. Wow. Hello. Hello, YouTube.
Hi, guys.
Hi, guys. Oh, the discussion will last for 20 minutes, yeah, Kadika.
All right.
Okay.
Maybe you can share your screen pool, especially for the specification of the medicine itself. Yeah.
Okay. Wait a minute. Share my
Hopefully,
screen for.
it's not too scientific. We still understand.
Mm-hmm. Thank you.
Nah, yeah. Yeah, we can discuss it one by one. Nah. Okay. It's still
yes.
divided into several slides.
Oh, okay.
Yeah, should set for the single one.
Okay. Oh my God. All right. I'm trying to share it. Oh, sorry, guys. I am going to present.
Sorry, maybe if your connection is poor, do you mind if I share the screen?
Sure.
Okay, okay. All right. Okay. 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 Maybe we can discuss it briefly because the time is short. It's brief. If from the dual collects book.
Oh, we can go to the additional questions because we don't use this.
Additional question.
Yeah.
I guess it's too short. We just discuss briefly about these 6 types of medicine.
Okay, 6 types of medicine. Okay. Yeah. Right. Let's go to the group 1. Dulcolax. Ooh, do you use it a lot, guys?
Sometimes I do. If
wow,
I have
what happened?
digestion, yeah. If I have problems with my digestion, yes.
Yeah. Okay. How do you use it, Sophia? Could you
So
please tell
yeah,
us?
like the one that you place in the picture, it's suppository. Yes, right. So I have to, I have to make it go in.
Yes, and Dulcolax is a laxative, so it can stimulate the stomach, the bowel movements. It's used to treat constipation or to empty our stomach before surgery or x-rays or other intestinal medical procedure.
No, I see. But is it safe because it's supposed, I mean, it's like out of our body. Like, I mean, do you get what I mean? Right? Is it
it's suppository,
like
right?
to
Suppository.
use every day?
Oh, no,
I
we
mean, to
cannot
use every day.
Yes, we cannot use it every day because it will be dangerous for us. We will be dehydrated if we constantly, like, you know, do go to the bathroom and then we try
like
to.
we are having a diarrhea, something like
Diarrhea,
that.
yes.
Yeah,
I see.
diarrhea will be the side effect, right?
Yes, if you consume it every day. And
see.
the way you use it, you can stand with one leg up on a chair, or you can also lie down with one leg straight and the other bent toward your stomach. And gently you can spread your buttocks open and then carefully push the suppository tapered and first about 1 inch into your bottom, and then close your legs, and you can also sit or lie down for about 15 minutes to let it dissolve.
Oh, I see, I see. So even though it's not in our not directly goes in by our mouth, but with our buttocks, but still, or because it's a drug, right? So there will be a prescription, and I see that is a blue one, like a circle, like the color is blue, right?
Yeah, the color. What is the color? Yeah, the color is blue.
It's
So
blue.
you can buy it without prescriptions.
I see, I see, I see. Okay.
What about the next medicine?
What do you call it for the Dulcolax scientifically, Po? In Indonesia, we know it as obat pencuci perut or pencahar.
Oh yeah, we call it laxative.
Laxative. What?
Laxative. Laxative.
Laxative.
Yes. Pencahar. Yeah, that's right. Yes.
For the combantrin, anti-worm or?
Oh yeah, anti-worm for the combantrin. We call it antelmintic. Antelmintix.
Right,
Yes.
right. Like it's a
Have you
lot.
taken this?
I'm
Have you
sorry.
taken this, guys?
What is
Have
it?
you taken this medicine,
Sorry?
guys?
Oh,
Combantrin?
Commentary. Yes, when I was a child, I was, yeah, when I was a child, I was like, yeah, I was so thin and yeah, lack of malnutrition because I
Oh my God.
like, yeah, among children my age. So it's like because the growth is like, yeah, failed to grow, something like that. Like the in midwife in Posyandu said that, and then yeah, so my
Yeah, that's right.
yeah, my mother forced
Yeah.
me to drink common drink. Yes, because maybe there's a lot of helmet in my yeah, in my stomach.
Oh, really? Okay. Yes. Well, thank you for sharing your personal experience in consuming this medicine. Sylvia, yes, it's called anthelmintic drugs. It is used for treating parasitic infections like worm. So this medicine kill parasites by binding to nerves and muscles cells, and it will cause eventually death of the parasite and blocking the transport of glucose by the cell. And yes, so how long do anthelmintic drugs work? So in general, the length of treatment is usually quite short, at most a few days. This will depend on what type of worm you have, or maybe like which medicine has been prescribed. For example, for thread worms, we usually use mebendazole as a single one of those. So yeah, what Sophia has said is correct. It will work against the helminth. That's true.
So that's why
It's
I used to
yeah,
drink this.
yes, yeah, and we need to drink this every 6 months, right?
Yeah, that's right. That's
Mm-mm.
right. That's right.
Yes. Okay.
Like
You
if
can. Oh,
we
please.
consume it too many, how the side effects will happen to us?
Oh, I haven't heard someone use it too many, but the side effects of anthelmintics, something that I know about it is, wait, if we take it too much, it will cause nausea, or you can like vomit frequently, or you will have diarrhea, or headache and drowsiness. So, and also trouble sleeping. So, if any of these occurs, you can tell your doctor. Maybe your doctor didn't know that you have taken that maybe a week later, a week before, or a month before. Yes.
I see.
In general, it's very safe, but if we take it too much, it will cause nausea and vomiting.
I see, I see.
Yeah.
And the circle is also blue, the color of
Yeah.
yeah.
Yeah, the color is also blue. So it's over-the-counter drugs. Okay, what about this one? Have you guys consumed it? What about Kadika?
Ometa. To kill the nauseous, right?
Yes. Yes, when you're feeling
What's
nausea.
it called scientifically?
It's called domperidone.
Domperidone. Oh, domperidone is the term, yeah. The
Yes,
scientific term.
the ingredients or the substances that is in Fometa drug. So Fometa is the brand.
From vomit, yeah.
And
Vomita from vomit.
yes, vomit. So it's the brand name, and domperidone is the content or the ingredient that is inside the Fometa. Yes. And domperidone is an anti-sickness medicine. It helps us to stop feeling or being sick, like nausea or vomiting, and it can also be used to treat stomach pain if you're having end-of-life care, like sometimes you feel like you're having too much gas in your stomach or in the digestive tract. It will be more quickly, and in this way, it will reduce the feeling of bloating and fullness and indigestion. So you can consume it.
For Antimo, is it the type of domperidone too?
Antimo, okay, that's a very good question. Yes, Antimo actually has the substances of Antimo is dimenhydrinate. So it's also medicine that will treat your nausea, but different substances.
But same purpose, yeah.
Yeah, same purpose.
Okay, but is it to kill for the motion sickness, right? Actually.
Yes.
The
motion
sickness. Like seasick, or you're in a car or in a bus for a long time, in a long distance.
Yes. Yeah, exactly.
If
Do you always take it, Kadika, every time you're on your way? Maybe.
What?
Do you always take it every time you are on your way, or
I've never taken it actually. I've never, because gratefully I've never had any motion sickness. Yeah.
Yeah. Okay. Yeah.
Yeah,
And
but it affects to the for the vision too, right? Like like we are reading on a moving car. Of course, you get dizzy and then nauseous and then
Yeah, you will feel sleepy.
for it likes you put the burden to your eyes, and then it affects to your throat and then your stomach. It falls down, and then the nausea comes.
Yes, exactly, because of the motion.
From the vision,
and
actually.
From the vision, and it can make us like this kind of drugs, this kind of medicine, like domperidone, can make us dizzy and sleepy. So before you drive or engage in any activity that requires mental focus, please don't consume it, because when taking domperidone, you will be sleepy. So please don't drive.
Yeah.
I will.
Yeah, because if you're sleepy, it kills your vision actually.
Yeah, it kills your
vision. For the certain time.
Yes, that's true.
You won't see anything, and then it will not affect
Oh my
your
God,
stomach.
so dangerous. Yeah, that's right. What about the next medicine that we always consume? Proma.
I use it a lot.
A lot? I think Sophia resonate with this medicine.
Yeah, because I have like gastric problems.
Gastric problem, yes.
So I drink like a lot of medicines related to my stomach.
Yeah, me too. Yeah, this Promac tablet is packed as a modern blister, which consists of hydrotalcid that will relieve our ulcer and neutralize and protect our gastric from gastric acid. So the formulations are hydrotalcid, magnesium hydroxide, and simeticone. So they work fast and protect our ulcer longer from staying, and it will protect us from feeling heartburn, nausea, or even bloating. Yes, but you need to chew it. Don't like swallow it. We need to chew it. Do you
Yes.
usually chew it,
Yes, I
Sylvia,
chew.
or you?
Yes, I
Okay.
chew.
Yeah, because some of the people sometimes just like swallow it. They don't want to chew it
Yeah,
because it
right.
tastes weird. I don't know why,
But
but it will.
I already getting used to.
Yeah, me too. I already getting used to. Do you know why we need to chew anticides?
Why? Because we will
Uh,
absorb better. Is it?
um, yes, it will dissolve better because antacid tablets are slow acting and have less neutralizing power than a liquid form. So tablet must be chewed. So
Oh,
it will interact directly with the gastric acid.
I see, I see, I see.
Mhm. And it also allows the calcium carbonate and other active ingredients contained in this tablet to work quickly and directly in the stomach rather than being absorbed into the bloodstream.
Oh, I see. So that now I get it why my doctor prescribed me to change it into the liquid.
Yeah, it will dissolve better and
Yeah.
absorb faster than the
Mhm.
tablet one. Yes.
All right. Yeah,
That still tastes weird.
Roma is very familiar to us. Yeah, because I
Everyone's
think
medicine.
everyone has had the stomach ache. Yeah.
Yeah.
Acid reflux, yes.
Yeah, and then the last two for the paracetamol is used to kill the headache, right, Pooh?
Yes, yes,
And
that's right.
maybe what type of
Because
headache? Migraine or the acute one?
yes, actually, yeah, that's right, Kadika. Paracetamol has an effects which is uh, analgesics and antipyretics. So analgesic means it can reduce, no, antipyretics mean it can reduce a high temperature. And then analgesic, paracetamol can also be a painkiller used to treat aches and pain. So what kind of headache? It could be all kinds of headache, as long as it's not too severe, because the mechanism of acetaminophen or paracetamol is they have broad mechanism, so we need to consume another painkiller to treat our aches and pain. Oh, everyone is back.
Hello. Hello,
Hello,
great
guys.
nurse.
Welcome back, everyone.
Welcome back.
Welcome back.
Hello.
How was the impromptu speech, guys?
Interesting.
How was it?
Great.
Awesome.
Love
Interesting.
it.
Yeah. Yeah. As I've said before, I hope by this impromptu speech, it does you favor, especially if you're interested to join our speaking competition in Busy Festival. Yeah, it helps
Yes,
you.
please join it.
All right. Before we dismiss the class, maybe any closing statement from you, Pupu?
All right, Kadika, wait a minute. Thank you everyone for sharing your thoughts and experience about how you use medicine and also how we can effectively use medicines. Hopefully what I have shared to you will be beneficial for all of us. And lastly, I just want to say that um, wait, Thank you so much. And understanding and being careful of any drugs that we are going to consume is a form of self-love and love for others around us. And without us knowing, it will also save the lives of many people. So please keep learning and keep educating people about how should we take medicine correctly and be more cautious and be more careful. So I think that will be all for me. Thank you very much. And I'm sorry for the unstable connection. And see you on the next class. Thank you.
Okay, thanks a lot, Pupu. And yeah, even though we are talking about medicine today, but yeah, please stay healthy. Yeah, stay healthy, and yeah, if your health has any problem, yeah, hopefully by joining this class, you have more knowledge about the medicine and the purpose of it and the side effect and how to take it properly. Yeah. And finally, me, Dika Narendra as the MC, sign out. See you guys.
See you
guys.
Bye-bye.
Thank you, everyone.
Thank
Thank
you.
you.
Thank you,
Thank you,
Kak.
everyone.
Thank you. Thank you, guys.
Be healthy, everyone. Thank you.
Thank you,
Stay
Kak
healthy,
Maureen.
Thanks,
guys.
class.
Thank you, guys.
Bye.
Bye, Denny.
See you.
Bye, Denny.